Well, hello, and welcome to January 2022's Got Health video presentation sponsored by Yora MC Center for Community Health and Prevention and the Central Library of Rochester in Monroe County. My name is Hannah Farley, and I serve as the Promotion, Education, and Targeted Outreach Manager at the Cancer Services Program at the Finger Lakes region. We're a grant-funded program that pays for colon, breast, and cervical cancer screenings and diagnostic services for individuals living within New York State that do not have health insurance and meet certain eligibility guidelines. We're based out of the University of Rochester Center for Community Health and Prevention in Rochester, and we service a wide region that includes Seneca, Yates, Wayne, Ontario, Livingston, as well as Monroe County. So, as you may know, as many of you may know, January is National Cervical Cancer Awareness Month. And our co-sponsors for Got Health video series understand the significance of this disease and its impact on the health and wellness of our communities. And so they kindly invited me to talk about cervical cancer risks and screenings and how to avoid this preventable disease. So in today's presentation, we're going to talk about what is cervical cancer, what are the risks for cervical cancer, what our screening options are, and then the screening guidelines. So, cancer in its most general sense is a disease in which cells within the body grow out of control. And cancer always is named for the part of the body in which its origin is, where it begins. And that's even if it does spread then to other body parts later. So when cancer starts within the cervix, it's called cervical cancer. And the cervix, it's the part of the body that connects the birth canal to the upper part of the uterus. And it's important to know that anyone with a cervix can develop cervical cancer. So cervical cancer begins with abnormal changes to the cells on the cervix. And these abnormal changes, if they're not detected and treated, can then develop into cervical cancer. And cervical cancer is a relatively slow growing cancer. And so most cases of cervical cancer actually begin with HPV infection or with the human papillomavirus. And HPV is really the most common sexually transmitted infection within the United States. And it's estimated that over 50% of adults within the United States will get HPV at some point. And most often, an HPV infection will go away on its own. But if it does not, then it can cause cervical cancer, as well as other certain cancers of the head and neck, anus, and genitals. Many individuals will get HPV infection at some point in their lives, but few will have it will have it cause cervical cancer. And luckily, there is a vaccine available. I know that the COVID vaccine is the most kind of popular vaccine at the moment, but there is an HPV vaccine. It's a type of vaccine available that targets the strains of HPV that are known to cause these cancers. And it's recommended that children be vaccinated for HPV at the age of 11 or 12 as a way to prevent these diseases. So, as I mentioned before, nearly all cervical cancers are caused by HPV, and that any individual with a cervix can get cervical cancer. But there are some other risk factors that do impact your risk for cervical cancer, and those include age. So cervical cancer most often occurs in individuals who are over the age of 30 years old. Also, not getting your regular cervical cancer screenings increases your risk for cervical cancer. So as we age, our risk is increased. If an individual with a cervix does not get their routine cervical cancer screening, that increases their risk for cervical cancer. Now, if that individual has a cervical cancer screening and the results from that cervical cancer screening show abnormal cells within the cervix, if that individual then does not follow up with their provider, that also increases their risk for cervical cancer. Smoking increases your risk for multiple cancers, including cervical cancer. Some other risk factors that aren't listed here but are important to know is that if you have been treated for cervical cancer before or for any abnormal cells within the cervix, then that can increase your risk for cervical cancer. If you have used birth control pills for 5 years or longer, or if you've given birth 3 times or more, or had multiple sexual partners, all those factors increase your risk for cervical cancer. If you have HIV or any other condition that weakens your body's immune system, that can increase your risk for this disease. And then also, lastly, if you have a mother who took diethylstilbetrol or DES while pregnant with you, that increases your risk for cervical cancer as well. So we have a couple options available for cervical cancer screenings. Because, as I mentioned before, an individual's risk for cervical cancer is increased if they don't have regular, if they don't have their regular screenings for cervical cancer. And a cervical cancer screening or a cancer screening is for people who do not have symptoms of that disease. So the two options that we have available for cervical cancer screenings include the Pap test, also known as the Pap smear, and then also the high-risk HPV test, high-risk human papillomavirus test. Both of these tests can be done during just a routine pelvic exam. And what a Pap test does, for those that are unfamiliar, is that a Pap test is looking for any microscopic changes in the cells that get scraped from the cervix. So it's a very small sample of cells that are scraped from the individual the surface of an individual cervix. It's as I said, most often done during that routine pelvic exam. If your Pap test results show any abnormal cells that may become cancerous, then your healthcare provider will contact you for a follow-up. And there are many reasons why a Pap test result might be abnormal. It doesn't usually mean that that individual has cervical cancer. It's just that there are some abnormal cells on the cervix. And really the most important thing you can do to help prevent cervical cancer is to get these regular screening tests, regular Pap tests, and follow up with your healthcare provider if that test does detect abnormal cells. So that's the Pap. There's also the high-risk HPV test, and what that test is doing is that it's looking for the types of the virus that are known to cause most cases of cervical cancer, which are those high-risk types. And the HPV test can be done at the same time as the Pap test, using either the same sample of cells or a second sample taken right after the Pap test. A positive result for high-risk HPV. So let's say you do, the individual getting screened does have human papillomavirus, a high-risk strain. That means that individual should be followed more closely to make sure that any abnormal cells do not develop or become cancerous. So these tests really are the great thing about these tests is that they make this cancer a curable and completely preventable disease. And actually the discovery of the Pap smear in the 1920s is now recognized as the most significant advance in the control of cancer in the 20th century. So, I just wanted to quickly point out some trends in cervical cancer mortality in New York State. So with the advent of the Pap smear and now that high-risk HPV test, as well as the HPV vaccine, we continue to see an overall downward trend in mortality from cervical cancer. This is from 1975 to 2018, and we just see that mortality rate decreasing over time. But that being said, there isn't quite an equitable distribution of the trend. So Black and African American women are twice as likely to pass away from cervical cancer than their white female from white counterparts, despite having similar screening rates. LGBTQ plus individuals tend to be less likely to get their regular health exams, and this includes certain cancer screenings like cervical cancer, which can put them at an increased risk for cervical cancer if they're not getting that pap smear or that high-risk HPV test. Individuals without health insurance and individuals who are below 200% of the poverty line are also less likely to get screened for cervical cancer, which can, of course, increase their risk. Now, these disparities can stem from a lack of access to high quality healthcare. They can stem from distrust in their healthcare provider or having a previous adverse experience with their healthcare provider, because we know that those things do happen. Having a pre-existing health condition, such as type 2 diabetes, obesity, or smoking, and other socioeconomic barriers that can limit a person's access to timely, appropriate, and high quality healthcare all kind of play into these statistics, influence these statistics. But what we absolutely know for sure is that screenings do save lives. So make sure, whether you work at a healthcare facility, whether you are someone that just knows they need to get screened, whoever you are, make sure that, and if you have a cervix, make sure that you get appropriate cervical cancer screenings. And if you're wondering when you're due for a cervical cancer screening, right here, this page here should help lay out for you when you need your screening. So these recommendations are based on both the United States Preventive Services Task Force guidelines, as well as the American Cancer Society's guidelines published in 2018. So individuals with a cervix ages 21 to 29 are recommended to get a pap test every 3 years. Individuals with a cervix ages 30 to 65 can have a pap test every 3 years, or a pap test with a high-risk HPV test, so some co-testing every 5 years, or they can just do that high-risk HPV test every 5 years. The reason that the high-risk HPV test is not recommended for individuals with a cervix ages 21 to 29 is that HPV is a very common infection, and it will usually clear up on its own. Testing for it would mean that we would get many more young individuals that would need more tests to follow up on an infection that really is likely to go away on its own. And then individuals with a cervix 65 years of age and older, speak with your healthcare provider about if a cervical cancer screening is appropriate for you. And then it's not recommended for individuals younger than age 21 to get a cervical cancer screening. And so again, just to kind of end this brief presentation today, I'm with the Cancer Services Program of the Finger Lakes region. We pay for breast, colon, and cervical cancer screenings. We pay for any diagnostic follow-up services. We can also help individuals enroll into the Medicaid Cancer Treatment Program, and we do not just work with although we're based out of UR Medicine, we work with health systems across the region. So, and if you need help paying for cancer screening services, please call this number on the screen or email us there or visit our website. And for more information on today's presentation, if you have any questions about when to get screened, who you should talk to about your screenings, how to get screened, where to go, feel free to give me a call or email me. So thank you so much. And I hope you enjoyed today's presentation and that you learned something. So take care, be well.